I do an update and I want to share a few ideas which is more like a conclusion somehow to a theory, what's going on, exactly what's causing so many secondary side effects. And I'm going to have a list. I have several ideas. I had to note them down because there are too many. So I may pass from one idea to another idea. Hopefully the total video is going to be fairly coherent. So just indulge me, and I need to add something which I didn't put in my list, is that I have this sort of concentration problems. I'll give you an idea, but this is not the subject of the video. I just want to point out because otherwise I would forget to say this thing. So when I type on my computer, I have this weird thing that I just type different words than what I have in mind, but usually it's a few letters also, but completely different words. That makes sense, not just random letters. And also it becomes more difficult for me to comment on videos. I have to always reread my comment completely from the beginning, because you will, if I don't do it, you will notice that some words don't make sense literally, and it's just sporadic. It's not full sentence that doesn't make sense, just a few words. This is the brain going bad, I guess. So we don't know what's exactly going on. But if I would just think about 15 years without normal sleep, and give you an idea. I just want, before, again, this is something else. Maybe I'm going to make a video separate for it. Yes, about the sleeping. So anyway, I did a few videos about a terrible worsening situation which was caused by dry air inside my room. As it was winter time, I had to heat up the room, which I stopped doing then. And I did explain at that moment that I've had this very strong suffocating feeling at night when I would lay or lie, forgive my English. So when I would just lay on the bed to sleep, within minutes my mouth would get really, really dry. It's just like a strange reaction. Also, again, there was that suffocation feeling would come with strong anxiety. I did explain this in another video. And that period also is when I had this, where I cannot even put words on these attributes, constipation. Hopefully some of you are going to laugh when I talk about this, but I'm going to say that constipation part is perhaps one of the biggest, if not the worst problem currently. And I did explain this in other videos. I lose weight. I'm kilo 73 or so, and now I went down to 62.13. I don't know how much. It's crazy because I'm a tall person. I'm 6 feet tall. So constipation not only is physically a problem, but also you no longer assimilate. The body doesn't absorb the nutrients from food. That's top of it. Anyway, one of my big questions that I said in another video, that I did just no longer cool down, warm my room. I stayed in cold. I put a humidifier to run continuously. And I do have videos on humidifiers if you want to check that. And from that moment on, also I started taking a lot of Metamucil stuff. Metamucil is not really good. I buy from a local brand, local grocery, not grocery, but drugstore brand, which appears to me is the best. It's the fibers that say original on them, because they switched the formula for some reason. Now the fibers are more fine, but are not really good, not effective. They still sometimes sell fibers that say original formula, and those are the ones that swell a lot. And I basically, I'm not sure if I did a video on this, perhaps I did it, not sure if I did upload it, when I just let them absorb water for a few minutes, and then it's gummy like, it's not too concentrated, it's gummy like. That's how I eat it. That's how I drink it with some water. And that helped my constipation problem. But now it starts being summertime, and although I have an air conditioner here, that air that's warm and dry, although I use a humidifier, but it's really the warmth of the air that started getting my constipation come back. I can feel it. It starts blocking again. Check my other video, see how I determine this. So it's putting pressure on me at this moment. And one of the questions that I have at this point, I think during those winter months, when because of the dry and very, very dry air inside the room and the heat, because of the electric heating, I say that during about 2 months, my lungs started to lose a lot of humidity. And I say this in other videos, humidity, but I need to be more specific. When these lungs lose humidity, it's actually blood volume. You just go ahead and Google up what's inside your lungs. It's not water. It's the lung. It's really if you want, mass of blood that's being exposed to the inhaled air. The lungs are completely filled with blood. Of course, it's tiny vessels, tiny spheres, but what's going on in lungs, if you take a lung and squeeze it, you are going to get, I don't know how much blood, maybe half a liter, half a quarter, so not a lot. But so when we say we lose, because there is this change in the lungs, I said in other videos, now because of the dryness of the nostrils over many 5, 10, 50 years, the lungs will start losing humidity, blood from the body instead of keeping it. And it's really like a dehumidifier of the body. It's just a transformation, pathological, abnormal transformation. The lungs start losing blood. And one of my questions that I had is, during these 2 past months of winter with room heating and dry air, the lungs started losing more blood. I could feel it in my body. I could explain in a moment how I could feel that. It started using even more, to a point where it was really critical. So, sometimes the body does go bad, but there is bad and very bad and critical bad. So this aggravation during these months of winter of the lungs, my question was, was it reversible? Why? Because just my theory here, I cannot do studies or take samples and put on a microscope or something, but when I say the lungs go bad, transform themselves in a wrong way, is that those tiny spheres, it's called alveoli with blood vessels, they somehow either enlarge or the blood vessels get larger. Something happens in there to start losing more than normal blood fluid, basically humidity. So this is a transformation. During these 2 winter months, I think it did got even worse, losing even more blood, fluid or volume. And my question is, that transformation, because of that very dry period of air this winter, did it reverse to the previous condition, which was already bad, but not this bad? Did it reverse because I cut the heating and I cut the dryness? Did it reverse, or did it stay like that? That's my big question. And so, in other words, before these 2 winter months, I was at a bad level, the lungs. Now, during those 2 dry winter months, it got worse. Did it get back to the previous level, or it stays there? Because if it stays there, this is not good news. I don't know how to put it, otherwise it makes me basically smile. It's not good news, because it's, you cannot live like that, basically. It's impossible. Now the summer is here. I will have to walk outside, and I limit very severely my stay outside in warm weather. But if the lungs start losing too much blood volume, that's it. Anyway, So that's a question. I don't have the answer because the summer is not there yet. It's still kind of springtime, coolish, and so on. We'll see how it happens. Now, let me get through this list. So I said, I think, I say that my personal now problem is constipation. I fight with it, keep fighting with it. But I think on top of this, or actually what is causing this constipation is, and this is, I think, I'm trying to imagine, so we have this damage on lungs, transformation, bad transformation on lungs, which I said, this is the, I would say this is the primary effect, side effect of nostril dryness over a long period of time. And I said this in many videos, and I do repeat it, keep drinking half a glass of water every half an hour or hour, even when you are young, or even if you are on plane, even if you travel, a job, even if you are climbing Everest, no matter if you are going to the moon, I don't know, in the space, keep drinking that half a glass of water. In my opinion, that's one of the things that before your lungs will get bad, will worsen, start losing blood because of nostril dryness. This is what you can do to prevent this damage to lungs in the long term. Start now. Don't drink too much water, 3 liters maximum, 3 quarts maximum over about 24 hours is important. Not too much water can cause body electrolyte loss and toxicity. Read online about too much water toxicity, just inform yourself, right? I did all this myself. I don't have a med doctor by my side. I took all this information. You know, perhaps already we are on our own on this problem. So I say that dry nostrils, lung damage, the next consequence is loss of blood volume. Okay, nostrils, lung damage, loss of blood volume. From the loss of blood volume, there is plenty, we can make a long video of this, plenty of issues. And in my opinion, this loss of blood volume, even if you drink water, if your lungs lose too much blood volume, you will not be able to compensate that. But at least you are doing something to help. So this loss of blood volume, now that I think back, just like a regular person, you and me didn't study or anything, but hopefully a doctor could help with some saying no, yes or no about this. Losing blood volume, having constantly a lower blood volume that's normal in your body, this now, to my understanding, explains many other subsequent following side effects that I had. And one of the first side effects that I had were my eyes got very sensitive at night to bright light, such as the headlights of car. I could not watch that light. It would hurt basically my eyes. I could not watch it. Other problem is I would walk outside, and after walking maybe half an hour, 1 hour outside, coming back home, 30 minutes later, my gingivitis, whatever, the gum started to hurt. And I say this in another video, this is a funny story. When going to my family doctor, to dentist, they wanted to remove my brain. They said everything is wrong with you, but none of them had any clueless that it was actually low blood volume problem. And that, by the way, gum pain went, they were saying infection, remove your teeth, completely random. How I got rid of that pain was drinking a glass of water before going outside for a walk. So that gives you an idea. So this is one of the things. I have a video and I show how my fingers, especially my fingertips, but sometimes even the complete finger, goes really like a cadaver white, corpse white, like a dead person white. They go out of blood. It hurts, especially not in freezing weather, but just a little bit of cold weather. It makes my fingers go this way. This is again blood volume problem, low blood volume. And I have to say that my fingers already, if you not sure if the camera will give you the correct colors, but my fingers already lacking blood, and I did some diabetes blood test, and you need to kind of get a needle and puncture your finger and get that droplet of blood. My finger doesn't give blood. I tried that thing. I mean, I haven't done like this, but so there is no blood in my fingertip. I mean, it's not the normal amount. It takes 1-2 minutes for the droplet to come out. So imagine that. That's just another example of low blood volume. When I lay in bed, when I get myself to sleep and mouth gets very, very dry, that's low blood volume problem. The blood volume in body is too low. What do I have here? Yes, another problem. Another problem that I believe is related to blood volume. Low blood volume is exactly what you see I'm doing now. My eyes feel very tired, and let's say from about noon, 12 in middle of the day, to about 3, 5, my eyes just start being blurry. I no longer can read text on my computer screen or something like this, or text on a label on a product in the grocery store. I can no longer have this. I don't know. My eyes no longer really work well, and also they feel sort of a dryness, tiredness, pressure to them. The image doesn't really change much, but it's really when I read some text that the text is it's not clear. It's the opposite of clear, blurry or something like this. I did try glasses; it helped, but usually I don't use glasses if my eyes don't feel like this. Let's say in the morning, I don't need glasses, but in the afternoon it gets worse and worse. And also when I watch a screen, which my screens already have low light, the backlight on the screens is very low. I need to increase the backlight to be able to read when my eyes go like this. And this is also caused by a low blood volume. And yes, you can go check your optometrist. Perhaps they are going to tell you maybe this or maybe try something else, but I'm giving you an idea. I believe this is a problem with low blood volume. Notice these things like eyes, teeth, fingers, all these are extremities of the body. So when there is low blood volume, there is less blood that goes towards the extremities of the body. And mind you, inside the nostrils is also an extremity of the body. That's why they also get dry. That's one of the reasons they may get dry. So this is with the eyes problem is also, in my opinion, connected to low blood volume problem. I'm going to give you an example of low blood volume. I did say that in when we eat something, we eat food, there is a delay. The food gets into the stomach, and after maybe 1-2 hours, the stomach, but mostly the intestine, starts the digestion process. So it starts, I would say, maybe 1-2 hours after finishing eating, and for the next several hours. And the more it goes, the more it gets intense. And also, depending on the food that you eat, this digestion, it needs more blood. So basically what the body does when you do a digestion, the body somehow is using, this is just a mechanism you can search online on Google. So the body will change the diameter of blood vessels across your body to concentrate more blood towards the intestine and stomach area for the digestion. So basically what happens during the digestion, you have slightly less blood around your extremities, limbs, head, and so on. That's why sometimes a big meal will get you tired because you have less blood in your brain and so on. This is normal process. That's how it works. Why? Because the blood around the intestines, it's what collects the nutrients. So the intestine absorbs the nutrients, passes it into the blood, and then the blood transports the nutrients around the body to feed your cells. I'll give you an example. For instance, when I wake up at night there is low blood volume because I dehydrate. I cannot drink enough water, and it's worse than during the day. This blood volume, it's lower than during the day, and also during the day it's already too low. So at night it's worsened. The blood volume it's even lower, and I wake up at night, and one of my problems waking up at night is, since I don't eat in the evening, I need to eat something at night because I get really hungry. I mean, I don't feel that much hunger, but I cannot sleep. There is such thing as insomnia due to low sugar in blood. That's hypoglycemia, not hyper. It's hypoglycemia. Too low sugar in blood amount causes insomnia. You can Google up on the internet. So that's why I wake at night. I just have too little food in my body, too low sugar from some of the food is converted into sugar, so the blood has too low sugar levels, and I need to eat something. So sometimes I did eat. I have these cereals, Rice Krispies, which are very low in sugar. I don't deal well with sugar when I don't eat sweet things. So I need those. I eat those cereals, Rice Krispies, which are low in sugar. Some of the nights. Sometimes at other nights I try to eat a piece of bread. So these are two scenarios happened in different nights, and the results of these two scenarios is really striking when I eat those cereals, because they are really easy to digest by the body. Those Rice Krispies, they don't take a lot of the intestine doesn't need a lot of blood to be concentrated, so the blood stays normally around the body. This is one scenario. When I eat bread takes much more blood to digest, so there is much more blood going towards the intestine when I eat bread at night, so the rest of the body has less blood. And when I eat bread, it's almost always towards the last hours of my sleep, towards the morning hours. I start having very powerful cramps, painful cramps, muscle contractions in my lower legs. I did describe this in other videos. So these painful cramps in my lower legs happen only when I eat bread at night. Never happen when I eat rice at night. So you see the difference now. These cramps in my lower legs, I start being tired. These cramps on my muscles, legs muscles, happen because there is less blood in the legs, because there is more blood required by the digestion of bread, which doesn't happen when I eat rice. There's less blood needed for to digest the rice. I don't get those cramps, and those cramps are, I'm fairly sure, are related to less blood in my legs, which I explained in another video. When there is less blood, for instance, your nerves or neuron cells find themselves in a drier environment, and they don't transmit well the electric impulses. So those powerful cramps may be because my neuron nerves or cells, it's just like several cells together. So because the neurons don't transmit properly the impulses, electric impulses, just like an abnormality of functioning of the neurons, because there is less blood in the legs at that point, and those neurons don't work properly in drier environment, less blood. That's why those cramps, powerful, painful cramps happen. Hopefully, I'm getting really tired by now. I need to concentrate my mind. Hopefully, I was clear with this explanation. This was a very interesting thing to observe. I mean, it's quite logical and it's very, very striking. I mean, it's very obvious the way it happens. Just another example, or if you want proof that there is too little blood in the body at some point. I think I got through, yes, this one, I'm going to talk about it. Two more things, hopefully I don't forget, about the diabetes. I did a blood test and it turns out I don't have diabetes. Yes, just before I talk about this point, so just want to make it more clear that suffocation, when I say I have feeling of suffocation, anxiety and so on, that happened only on that period of very dry room. So it happens only when the blood volume is very, very low at night, because the lungs lose too much humidity there. Right now, when it's cooler and I have an humidifier, I don't feel that suffocation feeling at night. I don't feel anxiety, and my mouth still gets a little bit dry, but is nowhere near as dry as when my body was very, very low in blood volume. So all these things go away. These symptoms that I did describe go away when the body has enough blood volume. That's interesting, I think. I remember people with ENS oftentimes describe this feeling of suffocation, this feeling of suffocation basically. And I did describe in other videos what I think are the mechanisms for this. There may be several things. There may be the fact that you have too much airflow inside the nostrils, the fact that the diaphragm, which is the muscle that pulls the lungs to breath, the diaphragm is no longer balanced in the force of pulling the air because the nostrils have been opened too much. But also it may be due to dryness inside nostrils and this malfunction in the nerves, which because the nerves don't pass the electric signal normally in dry environment, then the nerves may send the wrong signal to the brain that you are suffocating, when instead the body may have proper amounts of oxygen and carbon dioxide. It's just the wrong signal sent to your brain by neurons. Neurons are big cells. Neurons, when we say neurons, it's a cell, and it's the biggest cell in the body. Most of the body cells are microscopic, right? Tiny, tiny, tiny. Except the neurons start somewhere in the brain, and some of them go as far away, the same cell, just one, as to the finger, to the nail of your not nail, but to the toes of your legs. So that's, you may have a 6 feet long cell in your body, many of them actually, that goes. So this is Google up again. I'm passing some biological information here. Maybe people are surprised to hear these things. Just inform yourself, search on Google, and you will find out. It's quite interesting. So I was saying that I did at some point I said in videos that I believe I have diabetes. My eyes are so tired. I'm not tired. I'm not tired in the sense of I need to go to sleep or have a nap or something. It's just that my eyes are tired, and it's not because I look at my computer or something. It's just that this hour, this is like, right now it's 4 p.m. This is about the worst. It gets perhaps more, even worse about 5 p.m. and then it starts being better. Perhaps it's when the digestion is stronger hours that the body needs more blood towards the intestine. That is, there is less blood around the eyes, and extremities of the body. That's why it turns like this. That's why it happens through these hours. Because like I said, I finish eating no later usually than 2 p.m. But I start eating in the morning, so this is, if you want, at this moment now in the day, it's about peak digestion. If you want, the body, it's it's at work, the peak of the day. So I was saying that at some point I thought I have diabetes. Now I did blood test, and I did a blood test that did cover several things. My practitioner did, my doctor wanted to see something, also electrolytes, because I told my doctor that I drink a lot of water, and my doctor was concerned about having low electrolytes in the body, which is not a problem. The test went out well, everything went well, it's within the norm or standard, except for D vitamin, the vitamin D, which I guess is normal because it's winter time, there's no sun, and also I don't spend a lot of time outside, so there is no diabetes. I don't have diabetes. However, like I said, one of the reasons I was thinking about diabetes is this blood eye condition, the cramps and so on, but it seems it's not diabetes. However, there is one thing I cannot explain, and this is hopefully the end of the video, that some foods cause me to urinate a lot, and not just a lot, like every hour after. Usually it starts in the afternoon, about the same time my eyes go not okay. So some foods make me urinate like every hour. It's quite a bit of amount, but also there is this very strong urge to urinate. So this is something I cannot explain. It seems one of the possibilities that when you are constipated, the intestines are pushing onto your bladder. I don't know, maybe it's this thing. I did test at some point for urinary infection, and my doctor gave me some antibiotics. I think it's fixed by now. But it's really just some foods that appear to have either more salt, but I really eat very tiny amount, like slices of salami, 2-3 slices, no more than that. Sugar, I eat these cereals which are very, very low in sugar. That makes me this thing. Strawberries make me this. When I say food like this, is like 2, 3, 4 strawberries, really tiny amounts, which I eat in the morning. At some point, I'm not sure if I eat small pieces of cheese, not peanuts but nuts. I eat nuts. They also give me this urination problem. So overall I also anything that has even remotely acidity. I take this D vitamin. I'm not sure, it's not pills, it's something like supplement, and they have this orange flavor which has some orange, some C vitamin to them, added to them, ascorbic acid. Even that acidity increases my urination, and especially increases that feeling of urge to urinate. So it seems like it's this kind of acidity, salt, sugar in tiny amounts, nuts, I don't know, maybe there's something else that I forgot, that has this effect, and that I cannot explain. Why is that so? I mean, I don't have an information that I could find on internet that would make sense. The only thing that would that would be a possible explanation is that maybe the constipation part, but also the fact that intestines are not having enough blood to them. Maybe the nutrients transfer between the food and the blood through the intestine is not being done properly. So the body is extracting nutrients, which are, if you want, molecules of sugar, fat, I don't know, many types of molecules. These molecules are being removed from the food, pass into the blood, and then the blood goes around the body and needs to give those nutrient molecules to your body cells. My understanding is something doesn't work well in this extraction of nutrients from food, and I'm just stretching my theory here, right? Just my imagination. Maybe those molecules are, when they retrieve themselves in the blood, are not maybe are not caught correctly in the smaller molecules that can be absorbed by cells. So if those nutrient molecules are too big, let's just say this way, too big, too complex to be absorbed by cells, then they start flowing inside your blood. The blood is just like the truck that brings the molecules to your cells, right? That's how it works. So those food nutrient molecules retrieve themselves in the blood. They cannot be absorbed by the cells, and what happens then is that the kidney is like a filter of the blood. Basically, I don't know, I used to wrench on cars, so basically on your engine you have the oil that's lubricating all components and a filter. It's just like a filter. I don't know how to describe, like a paper media that the oil passes through. That's how it's not exactly like that, but that's what the kidney are doing in your body. They are filtering the I was going to say the oil, the blood. It's really just, imagine the kidney is a sponge, and the blood has to pass into the kidneys, and the kidney will remove, normally they will remove what should not be in the blood, and by removing the wrong components of, if you're on the residuals from the body, by removing these residuals, the kidneys create urine. So the way it goes is the blood passes through the kidneys, the kidney remove the bad products in the blood, they create urine, and they basically remove this urine from the body, and that's how you, if you want, you filter your blood, right? So if the blood is full with nutrient molecules that are not the correct form, size, I don't know exactly, that are not properly processed by the intestine because it's lacking blood, that are not properly processed to be absorbed by your cells, then the kidney will remove those molecules, even if they are nutrients. But if the body cannot absorb the nutrients in that form, the kidney needs to remove it. So this is my explanation why certain foods, why certain foods create too much urine and urge, because the kidneys are removing the nutrients from those foods, and the kidney create that amount of extra amount of urine and throw it away. So this will be another problem with maybe blood volume being too low. The digestion doesn't work normally, not just constipation part, that's one of the things, but just the digestion itself, the absorption of nutrients from food doesn't work properly. And on top of it, that's not enough, there's more. On top of it, you urinate too much, and that urine, where does it come from? From your blood. So you have low blood volume, because of food is not properly digested, absorbed by the body. The kidneys eliminate more urine, and that urine is taken directly from the blood. Again, for people who don't know anatomy, biology, you don't need to know it. I mean, go on Google and search what is urine created from. You will see from blood, literally. So it's not red, it's filtered, it's transformed, but it's taken from the blood volume, liquid, from the liquid of blood volume. So more urine, because the intestine don't process well the food, means even lower blood volume, right? So we start with low blood volume. The food causes us to, or myself at least, causes me to urinate too much, and the blood volume goes even lower. hopefully someone is going to do a PhD or several PhD on the subject, because I find if it's true what I'm saying, this is just a theory, right? Again, I didn't study biology or something like this, but this is just my logic, if you want. I try to find answers. So if it's correct what I'm saying here, it's all this, it's like domino pieces. It goes, erects all the whole game. So yes, foods that causes more urination, even less blood volume, and it's causing the condition to worsen. That's how it is. That's what I deal with. Just want to say that I have no, I'm not going to talk about this point. So if you have any questions, don't hesitate in the comment section, and I don't know, God bless, and hopefully you can manage this condition. And again, drink water, stay away as much as possible from dry, warm air. Even just dry, cool and dry, I don't know, but warm and dry is going to worsen this condition. It affects even more the lungs. So try to stay away, put your air conditioning at all time. Try not to heat the room with heating elements that dry the air. Try not to stay outside when it's too warm or dry. Just spend the least amount of time outside, and hopefully it helps you.